key advice do you have for recently diagnosed lung cancer patients?
I think that a couple of things, when it's the diagnosis of lung cancer is very overwhelming. And fortunately now there's a lot of resources online. But at the beginning, you don't know, there's a lot of information that you don't know. So sometimes if you go online, all you do is get scared. I think that you need to answer some very specific questions from your doctor. What is your stage? And then after your stage, my next question is like, what is the molecular driver of my tumor, the sequencing of my tumor? In the past, we thought all the lung cancers were the same, but now we know there are many, many different types of lung cancer. And they're the EGFR-driven cancers, the ALK, the ROS, they're all different. They all will have different treatment options. And when you go and look online, there's organized advocacy groups around each of these mutations, and then you can get better information and valuable kind of insight from the information that is out there. So I think the first thing is to, before you go in the internet, talk to your doctor about your stage and require, not like ask lightly, require that your genetic mutation, your sequencing is done at the time of diagnosis of advanced lung cancer, because that would really determine your treatment. Mm-hmm. So I think that it's very important for patients that get diagnosed. And then also understand that there's a lot of resources out there, so that you need to ask for questions, bring someone with you. During COVID, a lot of the clinics were closed, but we were able to have family members join virtually the visits, and now patients can come in with their family members. I find that having someone else in the room who wrote answers and wrote notes will really help you kind of get the most out of your consultation. Yeah. And also ask questions for the next time you come. Or, we have a portal where patients ask questions online. So I find that patients, that's the first visit is where you get the most questions answered. And sometimes it's like part B and part C. So you have to keep until you feel satisfied that you understand the plan. We also tell patients that, doctors don't know everything. Sometimes the doctor that you have is not the one that you feel you have a connection with. So know that you have rights, and there are other doctors out there, and you can get second opinions. So you are the best advocate. It's your life. And, you can rely on your doctor and their physician extenders, physician assistants, nurses, to get as much as you can from that. But also look outside of your institution. Maybe there's a better option for you.